I'm Dr. Rajiv. Let's talk about integration. It's a very important thing in the NMC syllabus. Okay, like how to integrate. There are two types of integration as per NMC rule: horizontal integration and vertical integration. So, in horizontal integration, like in the first MBBS, there is three subjects like physiology, okay, physiology, anatomy, and biochemistry, and these are first MBBS. So there must be some topics in which they all anatomy and physiology have connected, they have interlink, and they have a nexus, right? Even in the biochemistry, okay, there's something different. but I believe that there can be found some type of enzymes, okay, in the physiology that you can correlate with the biochemistry, okay. So there is, this is called a horizontal integration. Why it is called a horizontal integration? Because it is present in the first MBBS, right? Like PAB, okay. So there is an integration like this, so it is called a horizontal integration, okay. In the second MBBS there is pharma, okay, micro, and patho. Similarly, what is there? There is a vertical integration, there is a horizontal integration. Because I'm making it like this, it looks like a vertical, but actually it is something like this, yeah? Like this, okay. Now like this, there is some integration. For example, how can you integrate? Because there are systems. In systems, you can integrate the physiology and anatomy. In systems, you can integrate the pharma and patho, okay. Suppose you have a different in biochem and different in micro, right? Now, for example, say the third MBBS, suppose in the third MBBS there is PSM, I, and ENT. Now the anatomy is directly connected to the I and ENT. Anatomy is directly to I and ENT. Anatomy is very, very important, right? In the second year there is no role I can't say, but anatomy you can say there is there is from patho there is histopathological examination, and in anatomy there is histology. Okay, now let's see how these all are integrate. Right, so if we see in a vertical integration, there is anatomy in the first year, and there is in the second year, suppose there is pathology, and in the third year, suppose there is I and ENT, right? Now look in this, in these are in you will study in different years, right? Suppose you have started in 2025, then 2026, then 2027. So if a person is studying in the same year like 2025, okay, and they are integrating between the same subjects like physiology, anatomy, biochemistry, it is horizontal integration. And suppose the person is integrating with the subject with the previous knowledge. Suppose the student come in the second year, and now he want to correlate with the first year whatever he has studied. Now he is vertical integrating with the first year topics, okay. And again anatomy again it's there in the like wait, now why I'm telling you this, how it is so important, this horizontal integration and vertical integration. You can just look in this part, okay, that the fourth year MBBS did a different color, the fourth year MBBS have medicine, है ना, and surgery and gynae and obs, and there is pediatrics. See how I'm going to draw some connections. You can see over here, suppose in the first year there is some talking about microbes. So talking about microbes, for example, maybe in a particular place. Okay, there are no role of microbes in the first year, but just a simple introduction. There is right now. In the second year, there is micro in total, right? So we read about all the bacteria, viruses. Okay, so in second year there is microbiology. Okay, in detail. Now, what we see that the microbes cause the pathology. Okay, and these microbes again go to the PSM department, right? Because it causes the, here we study the infectious diseases, common infectious diseases, again further related to microbiology, right? And again in medicine and pediatrics department you study about the infective diseases, right? So overall, if you see that microbiology is the integration between the vertical integration with the PSM and with the medicine department. Okay, अब देखो, more integration. Pharma becomes the heart. Why I'm saying this? Because it has drugs in it. Right? Now this you can correlate that it is connected to the eye department, connected to the ENT department, obviously connected to the PSM department, connected to the, it is coming from the physiology department, right? Again with the biochemistry connected, है ना? Pharmacology connected with all the four parts in the long run of the fourth MBBS, right? So let's draw another table, small. Okay, use different colors. Okay, now see how. See, there is physiology, there is anatomy, and there is biochemistry, right? Now this is the first MBBS. In the second MBBS there is pharmacology, okay, there is pathology, and there is microbiology. Okay, in the final, oh, I have missed out the FMT here, right? Because it was there in this second year only, but now it's in the fourth MBBS. Now suppose in the third there is eye, there is ENT, and there is PSM. So forget about this, let's write PSM over here and eye, and there is suppose medicine, there is surgery, there is gynae and obs. Okay, surgery has ortho, gynae and obs, and there is pediatrics. Why I'm writing this in this order? It's a very good correlation. You can just see in 5 minutes. Okay, now suppose you have studied anatomy. Okay, now you can see if we connect anatomy and physiology, it is a horizontal integration, है ना? But if suppose physiology is normal, right? If there is something abnormal, it's studied under the pathology. Now to convert abnormal to normal, we need pharmacology, right? For any disease condition, to convert pathology, a pathological form to the physiological normal form, we need pharmacology. So that is a connection. Now you see, pharma needs again physiology information, knowledge, and biochemistry knowledge. Okay, a little bit of anatomy knowledge also, but mostly the biochemistry knowledge and the physiology knowledge. Now if you see that this pathology disease things will be there in eye also, all the ENT also, all parts of surgery when we study, in gynae part also, in pediatric population, in medicine, in community as such. Okay, so pathology again is connected to everything, all the diseases, right? All the diseases, And obviously micro, there is infection, right? So these infections are also there everywhere. Okay, you study in PSM, in INT, in eye, in medicine, in surgery, in even in ortho, everywhere, right? As well as in pediatrics. Okay, now if you can see, like, these all are there, connected. Pharmacology basically does what? It helps to convert the abnormal into the normal. If there is micro also, the infectious diseases, okay, which we study in the PSA mostly, but there in the micro also. Here, this micro, there will be, we study about the organisms, okay, and we try to destroy them. Okay, so there comes the chemotherapy. Here comes the chemotherapy. Chemotherapy basically the infectious ones. I'm not talking about cancers. Cancers are here. All the neoplasia. The cancers are here. Okay? All the neoplasia will be there in any organ. This is how you can study, right? So if you integrate between pathopharma, pharma micro, pathomicro, okay? So if you relate, you can see over here that in earlier days when my father was studying, there was anatomy and there was physiology and biochemistry in one paper. So one paper for physiology, one paper for biochemistry. Similarly, there was pharmacology, and there comes the there comes the microbiology and pathology in one paper. So there was there in only one paper, and also FMT was there. Okay, there was no INT, there was PSM. There was no INT because INT was there in surgery only, and there was medicine as such in whole, and there was even there was gynae ops was there in surgery only. Okay, then it was differentiated. Okay, ortho is still there in the surgery only, anesthesia is still there in surgery only, but it was, now it is same, but earlier it was, pediatrics was there in medicine only. Okay, so there was just one paper for medicine. Okay, so this was so concise, and this was bifurcated and made into many subjects like this for the ease of the students. So you have to understand the curriculum. Everything is integrated, everything forming a nexus. And why I'm telling that, you see, pharmacology still is in the heart, and it is a core thing which is there in medicine, that pharmacology actually helps to, connect you with all other branches. Okay, you can connect the dots from the back, you can connect the dots from front. Okay, so this nexus is very important. Again, you have to understand that yes, anatomy is there for eye and ENT, the surgical subjects. Okay, and as well as for the surgery, gynae, ortho. For example, anatomy, you have supex and infex, right? The supex and infex part will be studied in ortho, re-revised in ortho, because it is all about it's common sense, right? Also for the cardiothoracic. Okay, so lungs and heart are there. Okay, you will study everything about there in where? In pharmacology. You will study everything about in medicine, in PSM, like that. Okay, and eye and ENT are very small part. You study in anatomy, eye and ENT, in head and neck, then again you are going to study about ENT and eye in detail. Okay, so I am just giving you an overview here, how can you integrate vertically and horizontally. Okay, so so we have made these connections, and connections are very simple. So we can discuss one more thing, that all the pediatrics, okay, you go for biochem. All the storage disease are there in the biochem, right? Glycogen storage disease, lysosomal storage disease, whatever storage disease. And where can you see in which population this particular storage disease can be found? In the children, in the newborn. You can see that they have a defect. So where we will study about the storage disease? Again, biochem is directly connected to the pediatrics department. Okay, so this integration is very essential for a student to study from the second year. They should know about this thing, I believe. Okay, that biochemistry is connected to the pediatrics department, biochemistry again connected to the pharmacology department, as well connected to the pathology department as well. So there are lots of integration which you can do in your mind. Okay, how can you do the integration? You study the topics. You study the topics, and the topics will help you to analyze that the topics, how can you integrate other departments also. Okay, the books are very large, but you can do index studying. Index studying is what we do before exams. We see a topic, we go to the index of a book and we try to find the particular topic in the book, and then we study the whole thing and you make a small notes. Okay, so why not making a notes in a very smart way? When you study a topic and you know that in pathology, suppose any particular tumor is coming, okay, you know the tumor is particularly of maybe from ortho department only, so in supex infex, right, from hand. Okay, tumor is from hand, so you go and study about the anatomy, you go and revise a part from where this part, hand, the hand, you go and study about the hands, where it is happening, why it is happening, how it is happening. You studied in pathology. Okay, then you know the pathophysiological. This is the pathophysiological, this is what we say in pathophysiology when we go through the medicine and pharmacology, right? We study the pathophysio of particular disease, so this is the pathophysiology. Okay, so we do that, and we know that if why, how this surgery is coming. See, when this surgery came earlier, it was no surgery was there, only medicine was there. Medicine is the mother of all, mother of all, right? Mother of all, with pharmacology as its heart. Pharmacology at its heart. Why I'm saying this? Because earlier there was no role of surgery as such. We studied anatomy, but just to understand medicine. There was no surgery. Surgery came later. What medicine cannot do? Medicine means pharmacology. Why? Because everything is about drugs. Okay, if you don't know how to use a drug, what are the side effects of drugs and all, you will not become a very good physician. Okay, so you have to understand a detail in about drugs. We don't have to just give drugs everywhere. That's why for like antibiotic stewardship program we have started to make sure that the physician knows how to use properly the antibiotics, the antimicrobials. Okay, in chemotherapy we have studied for microbiology also, right, in all the diseases, right? So antibiotic stewardship program is for the physicians to understand the rational use of medicine, the rational use of an antibiotic, how to use, when to prescribe, right, all in detail. So we are basically doing what? We are telling the physicians to understand the importance of bacterial resistance. Where do you study about bacterial resistance? In pharmacology as well as in microbiology. Okay, so medicine was there, and whatever the disease were coming. So if you say about etiopathogenesis of disease, any disease, whatever you know, okay, if you study about etiopathogenesis of disease, I study it with like IT, like IIT. Okay, like IIT, or we can say just IT. Okay, how IT? I for idiopathic. I'll discuss. Idiosyncratic. Okay, I for say inflammatory. Okay, so these are etiopathogenesis. What is the causative organism, causative things, right? Inflammatory, infection. Okay, T say tumor, toxin. Okay, you can just connect, you can see everything comes under IT only. Okay, there are many things like suppose say idiopathic. What is idiopathic? Idiopathic means the doctor is idiot and patient is pathetic. Why I say this? Because the doctor don't know why the particular problem is happening. Okay, he's like, he don't know, he just give the treatment, right? Idiosyncratic, any drug reaction, है ना? There is also known as one more thing, There is also like a hypersensitivity reaction from a drug or something, right? There are inflammatory condition, there is infection, there is immune mediated autoimmune disease, all the autoimmune disease. Okay. Then in T there is trauma. In I there is iatrogenic मतलब डॉक्टर इंड्यूस्ड, है ना, डॉक्टर इंड्यूस्ड इंजुरी. ठीक है. ओके, देर मे बी इंजुरी or there may be trauma. Okay, so you see all the pathological phenomenons are there in the IT only, most of them, right? There are tumor also, toxin also, trauma also, है ना. There are, you can add more things in INT. Okay, I'm not recalling it right now, but you should know about this is only the etiopathogenesis. Whatever you study about medicine में पहले यही था. If you can treat with medicine, what do you mean by medicine is basically a drug, which is studied in pharmacology, right? So if you can treat with medicine and make your pathology, make your etiopathology into normal physiology or normal anatomy, then it's good. Okay, it's working. If medicine fails, तो उसके then you have to just cut it out with surgery, and this is the role of surgery. If medicine fails, then we go for surgery. काट के निकाल दो वहाँ से. ठीक है. So this is how you have to understand the whole logic about studying medicine, surgery. Okay, why it was there. Everything you study in the first year again comes back in the second year. Everything you studied in the second year, most of the things comes again in the final year. Okay, many topics are coming again and again, right? So the logic also comes in a different way. Look, how I study things, like for example you see medicine, and now you have this pharmacology as its heart. ठीक है. तो उसमें क्या करना है, उसमें लिखना है सबसे पहले, मेडिसिन में सबसे पहले, फॉर एनी डिजीज यू राइट द क्लिनिकल फीचर. Okay, you did the clinical feature, you go for the investigation, you go for patho department, you go for micro department. Why? Because infectious disease है या फिर कोई ट्यूमर, टॉक्सिन, ये सब चीज़ के बारे में पढ़ना है तो पैथोलॉजी डिपार्टमेंट. फॉर इन्वेस्टिगेशन यू गो फॉर रेडियो डिपार्टमेंट. ठीक है, कोई एक्सरे हुआ, ये हुआ, तो इन्वेस्टिगेशन कर लिए, ये डिपार्टमेंट्स दे रहे हैं. क्लिनिकल फीचर यू गो फॉर PSM डिपार्टमेंट, मतलब बिकॉज इट इज़ अ प्रिवेंटिव मेडिसिन, यू गो फॉर PSM डिपार्टमेंट, राइट. ठीक है. वो करके उसको हम लोग दवाई दे रहे हैं. लेकिन इस सब का नॉलेज कहाँ से आ रहा है? इसका नॉलेज आ रहा है फिजियोलॉजी डिपार्टमेंट से आ रहा है, इसका नॉलेज आ रहा है आपका एनाटॉमी डिपार्टमेंट से आ रहा है. देयर इज़ अ रोल ऑफ बायोकेमिस्ट्री डिपार्टमेंट ओवर हेयर. ठीक है. सी, दिस इज़ हाउ यू कैन और समराइज ऑल्सो. ठीक है. मेडिसिन का ही अगर एक पार्ट ले लिए, पर्टिकुलर ऑर्गन टाइप का ले लिए, तो गाइनी ऑप्स हो गया सर्जरी में. ठीक है. एक पर्टिकुलर ऑर्गन ये ले लिए, दिस ऑल कम्स अंडर मेडिसिन ओनली, बट स्टिल इट्स डिफरेंट ब्रांच टू, मतलब उसको और ज़्यादा डिटेल में पढ़ना होता है ना, इसीलिए उसको अलग कर दिया गया. ठीक है. मेडिसिन में ही सबसे बड़ा कनेक्शन जो होता है वो सर्जरी का होता है ना. सर्जरी में एनेस्थेसिया हो गया. ठीक है. अगेन if you go for radiology is there in the surgery also, is there in the anatomy also, because anatomy knowledge नहीं रहेगा तो radiology कुछ नहीं कर पाएगा, right. there is medicine से ही connected उसी का छोटा भाई हो गया pediatrics, because we study about the newborns. ठीक है. इन्फेंट पढ़ते हैं तो उसमें सुपर स्पेशलाइजेशन में जाते हैं तो न्यूनेटोलॉजी हो जाता है ना. So see, I'm still telling you, still focusing you, because the role of pharmacology is very very important over here. बिकॉज जब यहाँ पे आप डिटेल में पढ़ते हो, उतना डिटेल में फिर बाद में नहीं पढ़ते हो, है ना. जो आप यहाँ पे वट एवर यू स्टडीड ओवर हेयर, व्हेन यू गो टू मेडिसिन, वट एवर एक्स्ट्रा थिंग्स यू गोइंग टू स्टडी इज डिफरेंशियल डायग्नोसिस, हाउ टू कंपेयर एंड कॉन्ट्रास्ट between the diseases, right. So pharmacology again means the core branch. You study everything. You start writing the prescriptions. Wherever in life you write prescription, you have to understand how to write a prescription in pharmacology only, right. So I'm not just focusing on pharmacology. I'm telling every branch is important, but everything is connected. You don't have to say that okay, this branch is good, this branch is good, this branch is better. It's not like that. Okay, the very good general physicians, you've seen the market, the best person for a general physician is always a pharmacologist. Okay, because pharmacology, basically you don't know the term properly. It is pharmacology and therapeutics. So this therapeutics is actually the medicine. So we study, this is what we get in your MD degree. In your MD it's written pharmacology and therapeutics, and this therapeutics is all about treatment. This is medicine, this is core medicine. Okay, so most people understand, but they just ignore it. Okay, so just I'm telling you the basic thing, how to study and how to, like, it's not very vast. You can concise it, try to make it short. Okay, try to make it short and concise, because one topic you study over here can be repeated many times, but if you try to integrate it, it becomes very small. Okay, integrate it, you have to make small chunks of neurons studying a particular topic. Okay, your brain should know that, okay, this is your suppose there is pulmonary hypertension or asthma is there. Okay, so in asthma, everything about asthma, you study all about lungs. Okay, then you go for asthma in detail, you study pharmacology, you study anatomy, है ना, you study medicine, you study PSM. Okay, you study all the in PSM also you study about all the government guidelines, new guidelines. Okay, so I believe now you should go through this thing and you try to integrate it yourself. You try to think in a way, you have to think positively, that you can integrate all of the subjects together via the vertical and horizontal integration. This is what you have to do. If the teachers are not telling you, I believe you should do that, how you can integrate everything together in a one place. Okay, because brain is a small, it is a very peculiar thing. Brain needs small chunks of details. Okay, then it will be very easy for the brain to remember things for a long time. And if you try to integrate when you started to integrating enough, then you see how everything brain understands properly, right? You have to have a precise knowledge, very precise knowledge. That's the role of precision medicine. Precision medicine we talk about in pharmacology. This precision medicine, we actually give to the point, we study to the point, we give the patient to the point drug, the P drug, the physician's choice drug. We try to give what is the best for the patient, right? Okay, and also everything, like every patient is unique. When every patient is unique, you see now, every patient is unique. So what happens when we give a drug, we give what is required for the patient. This is what is all about, है ना? So every patient should be segregated. We don't try to give the same drug to every patient having the same illness, because their body physique will be different and everything will be different, right? So I just telling you to integrate and make it short, and then you can differentiate. Okay, so this is all about what I wanted to say. I have discussed a lot of things which will be needed now also, which you will need in the later part of your life. Okay, and when you just complete your final year, then you will understand why this particular video was important for you. Okay, so this is just for the second year MBBS, I believe, because first year में इतना समझाएंगे तो किसको समझ में आएगा नहीं. They will say that is no use right now. ठीक है, अभी तो फिजियोलॉजी एनाटॉमी फाइब्रोस्टी समझ में नहीं आ रहा है, बाद में पता नहीं क्या होगा. So I believe this is video for the second year student who are just starting doing the the clinical posting also, and they are having a lot of things happening in their brain. भाई इतना पढ़ना है, कैसे पढ़ेंगे, क्या करेंगे, किससे इंटीग्रेशन करेंगे, इसका मैं वो पढ़ा दे रहा हूँ, उसमें वो पढ़ा दे रहा हूँ. तो जो पढ़ा रहा है डजेंट मैटर. ठीक है, you have to know that everything will be there again, repeated again and again and again. This is all about medical science. And then you will remember the main important positive points, what is actually required to study medicine. This is how the MBBS is different from other branches. We study a lot, we study bar. Okay, we have a lot of revision. Okay, so when your brain have a lot of neural chunks and you revise, every brain part will be activated again and again and again. Okay, revision means revisiting the same topic. Okay, and the MBBS curriculum has revisit all the time. We study the same topics again and again and again. Okay, this is a half an hour, like a small video I have made for you all, and I believe when you study this now, you will get an idea that okay, it's not tough, it's easy, it's actually very easy. And how you can make it easy, it's up to you. If you want to make it difficult, it's very difficult. If you want to make it easy, I am challenging you, you can make it very, very easy. Okay, so all the best for your future.